Order this Buncombe County Board of Commissioners meeting. Please stand for the Pledge of Allegiance. Anyone parking for this meeting or using the bus may pick up passes on your way out, and it will be valid for today only. Ethics reminder to the board. In accordance with the Code of Ethics adopted by the board, all county commissioners have a duty to obey all applicable laws regarding official actions, to uphold the integrity and independence of the office, to avoid impropriety in the exercise of official duties, to faithfully perform the duties of the office, and to conduct the affairs of the governing board in an open and public manner. Is there any item on the agenda, the outcome of which will have a direct, substantial, and readily identifiable financial impact for any board member? Also, does any board member have a financial interest in any public contract coming before this board today? There being none, all board members have a duty and obligation to vote. We move to our consent agenda this evening. Does anyone from the public have questions or comments about this evening's consent agenda? Commissioners? If not, do I have a motion to approve the agenda and consent agenda as presented? Thank you, Commissioner Sloan. Do we have a second?
Second.
Thank you, Commissioner Whitesides. All in favor say aye.
Aye.
Any opposed? All right, we will move forward with the agenda as presented. All right, we move to public comment this evening. The time limit for individual comment to the board is 3 minutes. When you come to the podium, please state your name before you begin speaking. If your time expires, you may leave any question along with your name, address, and phone number with the county manager or clerk. Board members are not expected to comment on any matters during public comment. This is your time to speak to us. All public comments must be directed to the board as a whole, not to individual commissioners, staff, or audience members. No clapping, snapping, or booing is allowed. The board reserves the right to deny public address on any subject previously presented to the board during the same meeting. We have one person, Gino Perez, who has signed up to speak to us this evening. Gino, you'll have 3 minutes to speak to us. Good evening.
Good evening, Commissioners. My name is Gino, and I come here tonight to ask for a small change in policy that will result in great changes for the lives of seniors who live in Buncombe County. I run a transportation service for seniors and for people with physical disabilities to stay connected and to live with dignity. Many of seniors call our service for grocery rides. These same seniors, however, also use Mountain Mobility for their grocery weekly trips. There's an overlap in our services, and I did not understand it until I kept hearing the same concern from seniors throughout the county. You see, Mountain Mobility has a policy that limits passengers to 2 grocery bags that can fit upon their laps. Now I ask you, Commissioners, how many groceries can you fit inside of 2 grocery bags? How many groceries can a 75-year-old grandmother carry on her lap in 2 grocery bags? This policy is creating food insecure seniors, and it comes at a cost. By our estimates, it costs Buncombe County between $38 and $46 a head to transport people to the grocery store. And yet, because of this policy, the needs of the people are not being met. The cupboards and pantries of our parents and our grandparents are bare, even after returning from the grocery store. That is why, when they use our service, they emerge from the grocery store with a cart full of goods. And they say to me, I may have bought too much, but I know not when next I can come. Now, here is where I offer solutions to this problem. I believe that by raising the limit of grocery bags of a person can take, you would alleviate a great deal of suffering. You could do this by creating cubbies beneath the seats or in a designated area in the vans. There's a second issue to address. How do the seniors transport the goods into their homes? And for this, you have someone readily available, the driver. I believe that if they are trained and paid with the excess funds you would receive from fewer grocery trips, they would happily help their neighbors and the people they love. Thank you for allowing me to speak and for listening, and I hope that you look into this policy. Changing it would change a great deal, many lives. Thank you.
Thank you, Mr. Perez. Are there other members of the audience who wish to speak who did not sign up? Yes. Please come forward. You'll have 3 minutes if you'll state your name.
Good evening. I'm Shelley McKechnie, and I'm here to thank you for taking up item number 3 under new business, the passive recreation grant, the funds. I'm involved in one of the projects that's under consideration tonight. It's one of the smaller ones. It's small, but it's mighty. It means a whole lot to our neighborhood. So I'm here to thank you for taking that up, and I hope you vote our way. Thanks.
Thank you.
Thank you.
We appreciate you speaking to us this evening. Any other members? All right, thank you all very much. We move to our manager's report. Avril, do you have a report this evening?
Madam Chair, no report.
All right, thank you. All right, we have our first presentation this evening. We have a transit comprehensive operational analysis with Ricky and, are they here?
I'm online. Ricky
Oh,
and
they're
Data.
joining
Can you hear
virtually.
me?
I apologize, I did not see that in my notes. And city staff is here as well. Okay, I apologize for that. Hello, good evening.
Is city staff there going to give an introduction? I can't see the whole room.
Jay, did you want to give an introduction? They will. They're getting ready to give you that introduction right now.
Thank you.
Perfect. And-
Good evening, Commissioners. My name is Jessica Morris. I'm the Assistant Director of the Transportation Department with the city. Thank you for having us here tonight. We have been working for the past probably 7 or 8 months on a project that we're referring to as our comprehensive operations analysis for our transit system. We're focused on just the fixed route portion of our transit system, so the Asheville Rides Transit. We have been doing a lot of data collection, looking at our existing system, and doing public engagement to learn more about what the needs are, what the concerns are, and what how we can best allocate our resources for our transit system. So I'd like to introduce to you Ricky Anguera from Jarrett Walker and Associates, which is our consultant. And then we're here to answer any questions you may have. Thanks.
It looks like I'm not allowed to share my screen. Can someone give me permission to share my slides? Okay, perfect. I got it. Can everybody see and hear me?
Yes.
Okay, perfect. All right, so first let me tell you a little bit about this study and about where we are in the process. So this comprehensive operational analysis is divided into 3 phases. The first one is called choices, which is where we looked at the existing conditions and we thought about key trade-offs associated with transit. And now we're in this second phase called concepts, where we have developed conceptual alternatives of what the transit network could look like in Nashville, and that will be the bulk of what I'm talking about today. And later, we'll be developing a draft plan that will go out to the public again, and we will be asking the public if we have the network right before finalizing anything. But no decisions have been made, and I'm here to tell you about the key transit trade-offs that we are addressing throughout this study. First, I want to start by talking about what makes transit useful. I want to start by talking about access to jobs, access to opportunities. Imagine a person. Her name is Jane, and Jane lives in a city that is full of many possible destinations. Places she can work, places she can study, things that she can do, people she can meet, all kinds of things. If we look at the transit network, we can draw a bubble that shows where Jane can get to in a given amount of time. So this bubble shows that in 30 minutes, where Jane can get to using transit and walking. And if we put this bubble on top of the city, then we can count all of the jobs that Jane can reach. And that is Jane's access to jobs. It is the jobs that she can actually reach in a reasonable amount of time, which means that those are the jobs that she can actually hold and actually go and commute for. We look at jobs because that is the data that is available, but it's also the same type of analysis and a really good proxy for all kinds of other opportunities. Education, shopping, medical services, worship, all kinds of things. When we're thinking about these bubbles and we're thinking about access, it's important to remember that we're considering all parts of a transit trip. Because transit is not just the time that you're in the bus, it's the time that it takes to walk to a bus stop, wait for the bus, and actually ride the bus. So all those things are in these bubbles. Why does it matter? Access matters because by calculating someone's access, we're calculating the possibility of things that they can do in their lives using transit. If someone has higher access, then that means that the service is more likely to be useful to them because they can do more things. They can reach more destinations. And if the service is more useful, then it means that people are more likely to ride transit. Which means that if you want to maximize ridership, what you really want to do is maximize access. And we do that by making these bubbles bigger. And we can make these bubbles bigger by tweaking the transit network and following this recipe. We would design a network that has high-frequency service in the places that are the most transit efficient. Those are places that are dense, walkable, and linear. Why? Because this is how you can bring the most useful destinations within a reasonable travel time of the most people. Frequency is extremely important because waiting is just a big part of any transit trip. So if the bus is more frequent, then people wait less and they can spend more time on the bus getting to destinations within whatever amount of time they have in their day. And if the bus is taking them to these transit efficient places, then it's already taking them to places that have a lot of useful destinations for them. So this is what you would do if you want to maximize access and if you want to maximize ridership. But you will never hear me say or recommend that you should want high ridership, because ridership is one goal, but it's not the only goal associated with transit. There is an opposite goal called coverage, and that brings me to the ridership coverage trade-off. Imagine this little fictional town. The lines are streets, and the dots are people and jobs. You can see that most of the activity is on 2 main corridors, so about 70% of the people and jobs are in 2 main corridors. We have 18 buses, and we're going to design a transit network here. If you hire me, the first thing I would do is ask what the goal is. And if you tell me that the goal is ridership, and ridership alone, I would design a network that looks like this. I focus all of the service on just the 2 main corridors, following that recipe that I was talking about before. Because all the service is on 2 routes, that means that the buses are coming very frequently. So here you might get a bus that comes every 10 or 15 minutes. Which means that a lot of people are going to find the service very useful. The people that are living along those 2 corridors, they're not going to have to wait a long time for a bus. They're going to be able to reach many destinations very quickly, and it's easy for them to transfer to the other route because it's also frequent. So in this network, you would expect a lot of people to ride transit, and you would expect to get high ridership. But this network doesn't go everywhere. Mrs. Jones lives down here in the southeast, and she doesn't have any transit service. If you want to provide service to Mrs. Jones in the southeast, to Mr. Smith in the northeast, and to everybody in every little corner of this town, then maybe what you want is not ridership. And maybe what you want is coverage. And if I were to design a network that focuses on coverage, it would look like this. I spread the service out. So instead of 2 routes, I now have 10. But in spreading the service out to reach many, many places, I'm also spreading the service thinly, which means that the buses here only come every 60 minutes. If the service comes every 60 minutes, not a lot of people are going to find that service useful to them, because not a lot of people have patience or time in their day to wait for a 60-minute bus. So in this network, you would not expect to get high ridership. But that's okay, because remember that the goal of this network is not to get high ridership. The goal of this network is to provide high coverage. And it does that very well because it reaches every little corner of this town. Now, both of these goals are important, but they lead in opposite direction. Within any fixed budget, you have to decide how you allocate your resources. You can have less routes that are more frequent, but don't go everywhere, or you can have more routes that go to a lot of places, but they only come every 60 minutes. So if you're going for a ridership goal, then be thinking like a business. You choose the markets where you want to enter so that transit is the most useful to the most people and you can maximize access. So because a lot of people would ride transit, there will be a lower subsidy per passenger, and it aligns with all the sustainability goals. So that would be supporting dense and walkable development, reducing vehicle miles traveled, and reducing emissions. Because sustainability and environmental goals don't just arise from transit existing, they arise from people using transit a lot. If you go for a coverage goal, that would be providing a little bit of access for everyone, and it's really hard to be against that. You support suburban low-density development, and what you're doing is providing lifeline access, minimal lifeline access to as many people as possible, regardless of where they live, by serving as many neighborhoods as possible. Now, both of these goals are important, and neither one of them is better than the other or objectively correct or technically correct, because the choice between ridership and coverage is not a technical choice, it is a values choice. And within a set number of resources, within the number of buses that ART has today and the money that they have today, they can't do both of these. So there's some very difficult decisions to make. And so what we're doing through this process is thinking about where on this spectrum between these two should Asheville be. Today's system is heavily focused on coverage. What Asheville is doing is spreading their service out to reach many locations, but buses only come every 30 or 60 minutes. So they're not very frequent and not very useful for a lot of people. But they are reaching a lot of areas in the city. And there are a lot of people that do use the service, and they're very appreciative of the service. But it's still providing coverage, and it's not getting very high ridership. And you can't expect the network today to be judged on its ridership because it's not designed to get high ridership. So, because it's so hard to choose between these two, what we have done in this phase of this project is design two conceptual alternatives that show what the network could look like in Asheville if you focus on either one of these goals. So we design a network focused on ridership, and we design a network focused on coverage. Very quickly, just to touch upon them, this is the existing network. The colors on the map are always really important. Orange is a route that comes every 15 minutes, dark blue every 30, and light blue every 60. So the existing network has mostly blue routes, which means that they come every 30 or 60 minutes, providing a little bit of service to a lot of places. But we know that there are some challenges with the existing network, which is part of the reason why this study came to be. A lot of the routes have poor on-time performance. Only 62% of buses are on time. And there are difficult connections today between routes. So there are challenges in the network today, which means that it's a good time to take a look at it. This is what the ridership concept looks like. So that's existing, that's ridership. There are a lot less routes, but they are orange, which means that they come every 15 minutes. So the ridership concept removes a lot of routes from a lot of places, a lot of neighborhoods, and a lot of developments to be able to focus service on just the main corridors with service that comes every 15 minutes. And within the current resources that ART has, to be able to provide 15-minute frequency, this is what it costs. It costs removing a lot of routes to be able to provide that higher frequency. So 5 main corridors come every 15 minutes and a little bit of additional services every 30, but removing a lot of routes. Key features, higher frequency along the main corridors, higher access, because the higher frequency means that those bubbles that I was talking about before are bigger. So residents can reach 10% more jobs and 10% more opportunities, but there's loss of coverage because there are less routes. And this is what the coverage concept looks like. Similar to today's network, with a lot of routes that go to a lot of places every 30 and 60 minutes, and spreading the resources out. So everybody that has service today would continue to have service, but it's not exactly the same network as today. We have done some tweaks in this concept on some routings that would improve on-time performance and improve connections. So the big question that we're facing in this study is ridership and coverage. Ridership or coverage. It is a very difficult decision. And the reason why this question comes to be is because of the limited resources that are spent on transit in Asheville and in the region. With the current budget, you can't do both of these. And there are very difficult decisions to be made. But that's just how transit works. It's just the mathematical trade-off of the physical reality of what transit is. And with that, I'm happy to take any additional questions.
Thank you, Ricky. Commissioners, are there any questions?
I've got one or two.
Sure, go ahead, Commissioner Sloan.
So in this presentation, I, of course, focus on that map with your arrows on either side showing the two kind of broad choices. I assume those maps are certainly informative, but I assume they're conceptual and not the actual kind of binary choice, but you can correct me if I'm wrong. With that said, I think my question is, there's routes that go towards Black Mountain, right? There's other routes that go beyond the city limits that don't exist on either map from that slide. So I think my question is, in a ridership focused model, what happens to the other routes that exist beyond the city limits of Asheville? Mm-hmm. Or how does this impact those routes?
Yeah, good question. So yes, these are conceptual maps, but they have been designed with the current budget in mind. And so these are implementable as they are, but they are conceptual because they're just showing the other ends of the spectrum, and it's a spectrum, so there's many possible points in between. In terms of the service that's outside of Asheville, in these maps, we have a dotted line that goes out towards the east, towards Black Mountain, and we have kept that in there because that is partially a different funding source that comes from the county. And so because this is a City of Asheville study, we've been focusing on what the service is within the city, but that dashed line is there because if the county continues to pay for that service, then it will continue to be there in the future. In the ridership concept, if that were the direction in which this would go, some of the routes would shrink, which means that the connection to services that are outside of the city itself would be a little more difficult. But that's a conversation that we can have if that ends up happening. But for the most part, there are routes that could potentially be extended, but that's a more technical conversation that we can have later.
Okay. Well, thank you. I think this is, my I guess, experience, observation, living in the South my whole life is that transit systems rarely change in any sort of significant way. So I applaud the city for looking at this and trying to really just decide between these difficult choices. It certainly seems like a ridership model, or something slightly skewed a little bit more towards ridership could really kind of change the game in terms of the quantity of persons using this system. So I applaud them for looking at it.
And I will also, second that. I think it's great that we're looking at what is an effective model. The questions that I have, and you just spoke about this, I'm curious if you could expand a little bit on it. Could you speak a bit to how the county funds part of the system and the considerations that are taken into account when potentially looking at shortening lines that once they extend past the city limits, the county is then paying for those? Can you speak to that interplay a little bit?
Mm-hmm. Yes, I can. So today, I believe the county is paying for the service when it leaves the cities and just paying for, I think, just the exact revenue hours or the quantity of service that is outside of the city. And so in these concepts, the service towards Black Mountain has a dashed line that can continue in either one of these concepts. If there is a case in which we were to go towards ridership, then we would think about that and we would make sure that we're having a conversation with the county as we're developing the network. But overall, service that's outside of the county is mostly untouched. But there are a few places towards the west where there might be a few tweaks that might need to be done. But remember, the purpose of this is to think about the entire network holistically. And so that's a step that we would take if the direction towards the draft plan were to focus a little more on ridership.
Thank you. And then the other question I have is, do you have data on which routes have the highest ridership? And can you speak a bit to how maybe data has influenced these decisions? Because ideally, we're making data-driven decisions, and if we're going to reduce lines, those are the ones that are least used, and if we're going to maintain and increase frequency on certain lines, those are the ones that have the highest usage.
Yes, definitely. We have ridership data that we have been analyzing. What we also use a lot when we talk about transit planning is what we call productivity, which is ridership relative to quantity of service. So per revenue hour is the measure that is used to measure the amount of time that a bus is on the street. So we look at productivity per route, which tells us which routes are getting more bang for the buck. And we look at every route, and so as we're thinking about where to put the high-frequency services in the ridership concept, we're looking at existing ridership, but we're also looking at land use. It's a little hard today with your existing network and the low frequencies to assess the potential ridership and success that you can have, because a lot of it's just low frequency that a lot of people don't find useful. So if you really want to focus on ridership, it's important to look at land use. And when we look at land use, what we look at specifically is density. The density of people, the density of jobs, just density of activity. Because if there are more things close to bus stops, then it means that there are more potential customers and potential people that could use transit. So yes, we're looking at existing ridership, we're also looking at land use to assess the potential markets for transit.
Thank you for that. And then the next question is, could you speak to how the amount of ridership impacts the amount of federal funding that we get, and how this change may increase or decrease the amount of federal funding? And if it increases federal funding, does that then allow us to ensure that we're still maintaining a significant amount of the coverage model?
Ridership is included in the federal funding formulas, but it's minimal. What they account for the most is revenue miles. They measure just the miles that the buses are running, and they use that as the main factor when they distribute federal funding. Ridership is considered, but it's very, very minimal, and so I wouldn't suggest that you have that be the decision behind deciding to do either thing. The fact is that there is difficulty in funding right now within the system as it is, and so ridership alone won't get you that federal funding that you really need for additional service.
Okay, great, thank you. And if you can share the ridership and land use data that you're using to make these decisions, we'd greatly appreciate it. Thank you for your help.
Yeah, I can actually point you to the report that we created at the beginning of this project that has all of that together. We called it a choices report. It is on the project website, and there you can read all about the analysis of the existing network, the analysis of land use, looking at the market and needs, and a couple of additional things, and key trade-off questions associated with transit. That's why we don't just call it an existing conditions report, we call it a choices report. You can find it on the project website, and feel free to contact me if you have additional questions or want to talk.
Will do, thank you.
And with
Other questions?
that brought up something for me when he mentioned the land use. Recently, I saw a presentation. It was when the Richmond Federal Reserve meeting, when they were here, and Tristan from Landesky did a presentation. And I think that would be very beneficial for us because it was speaking specifically to transportation and housing patterns and that land use that Ricky just mentioned. And I think that could be very helpful for us as well if we could have that presentation. Because partly he was showing different scenarios around land use and then how that impacts transportation. And I have one question for Jessica, probably for Jessica. Looking, there was a graph. It was, I saw it from like 2016 to 2022, and there may be a more updated one now. But with that, it was showing the ridership was taking a trajectory of down, and the funding was certainly going up. That was from 2016 to 2022. It was pretty dramatic change, and I was wondering if you could speak to that, or maybe you have more updated numbers since '22.
Yes, we do, and we can share that. We had a peak ridership right before COVID. I want to say we had about 1.8 or 1.9 million rides per year. And then 2020, of course, things went down. And we are, I think in 2024, fiscal year 2024, we had about 1.6. So we're steadily gaining back, but we still have not yet returned to pre-COVID numbers. So this study was also really important because we needed to look at changes since COVID, changes since Helene, and so all of that is being incorporated into this analysis as well.
Thank you.
All right. Thank you all. We appreciate you being with us this evening. Our second presentation this evening is from VIA Health, and Angela Garner is joining us from VIA. Good evening, Angela.
Good evening. Thanks for having me to talk about VIA and give some updates of what's going on our side of the shop with the state and local and federal. Okay. Just a quick overview of what VIA Health is, managed care organization, local management entity. Am I controlling this? Okay. All right. So who are we? We're a local political subdivision of the state. We are governed by statute. We are one of 4 tailored plans in the state of North Carolina, and we manage public funds for mental health, substance use disorders, intellectual and developmental disabilities, and traumatic brain injuries. And we serve a 32-county region in the 100 counties in North Carolina. This just gives a little bit of the statute definition. As some of you may recall, we started out as the area program back in the late 70s and then moved on to variations throughout the years, from Blue Ridge local program to Western Highlands to Smoky, and then now we're VIA. And so what's a tailored plan? Well, July 2024, we had the launch of a lot of different Medicaid transformation plans here. And so, as I said, VIA is one of 4 tailored plans in the state that manages public funds for the services I just discussed. We also not only manage behavioral health, but we manage medical as well. So that was one of the big changes in the tailored plan for us to basically move towards a plan like Blue Cross and the others. Whereas in the past, we were just managing the behavioral health side of the shop. And if you were receiving services through VIA or Smoky or Western Highlands in the past, we were just responsible for your behavioral health services. So now with tailored plans, what the state said was, look, we want these state-funded programs to also manage your medical needs as well. And so that's what we do along with the 3 other tailored plans in the state. And so we have a utilization department, a claims department, we have pharmacists and nurses, but again, we contract with agencies to provide the services. We do some services, light touch, and then some in the community with care managers that do work with individuals who have higher level needs. But a majority of our workforce, is behind the scenes. And this is a nice map to see of the entire state and the other 3 managed care organizations. We've taken on a few more counties over the years. We started out pretty small. We've expanded a little. I want to give you a few local highlights of just a few initiatives that we're doing just specifically here in the county. And one of them is called the Co-Responder Program. And a few years ago, in spring of 2024, we received funding called the Bipartisan Communities Act, Safer Communities Act. And what we did was partner with RHA, which is one of our behavioral health providers here, and they're actually statewide, and then with the Sheriff's Office to help with this co-response program. And so how that looks is with this funding, we're able to fund mental health clinicians to work with 2 sheriff deputies that go out and work during the week from about 8 to 8, Monday through Friday, with that funding, to work with folks who may have or be in mental health distress, have substance use issues. When the calls come in to the 911, they're able to sometimes parse those out and say, you know what, this may look like a co-response issue instead of maybe needing to send an ambulance, or EMS does show up and says, you know what, this person doesn't have medical issues necessarily. We're going to see if our co-response team can come out here and work with this individual to link them to services. And just a few data points on that from quarter. From quarter 1, so that would be of this fiscal year from July to September, there were 189 referrals, and again, those would have come from dispatch or EMS or deputies on the ground responding to calls. So the responders received 189 referrals. Out of those, there was just 1 arrest, and 78% of those referrals were diverted from the emergency department. They were able to link those individuals to assessments, maybe at RHA, at the urgent care center, or to mobile crisis, or even to link them to an appointment as well for any type of assessment. Child recovery programs. So we have received funding, Hurricane Helene-related funding, and a small piece of that, we've used it for other projects and initiatives, but I'm highlighting this here. We were able to fund summer camps for youth and that attend Elida. As you can see, 65 campers per week. Then as summer ended, we said, you know what, this funding is still here for a certain type of youth and family who may need this type of a program and aren't able to afford after-school care. So we have been working with the Asheville City Schools Foundation with some funding, so they're able to parse that funding out to work with kids who are in their foundation for services that are needed. And then the Workforce Development Grant. As you can see here, we were awarded a grant through Dogwood. And what we did was it was a $300,000 grant, and there were a few initiatives on this, as you can see. And one of the initiatives that we're working on right now is collaborating with Western Carolina and Appalachian State because those schools were and are in the counties that were affected by Helene, and we're working on a stipend program, $5,000 to students who are in graduate level programs who will go out and work in some of the more rural counties to provide behavioral health services. So we're working with a few agencies to connect those students to work out in the field, and a few of those would be Helping You Heal, which is the name of an organization that provides enhanced services for adults in the community, RHA, and a few other local organizations that are further out west, Vecinos, in the western counties. Another, you've heard of this, I'm sure, and seen some of the signs, the Hope for NC grant that we received after Helene. So part of that grant was to hire workers through VIA and then to contract with peer support specialists through Sunrise to provide services in the community. We do have an extension through the end of January, we just heard, through SAMHSA and FEMA. But just a few numbers here, you can see the contacts that our peer support folks and some of our liaisons have had since probably the end of last year. I'm not going to go into depth. I just want to highlight that VIA does have a transition and housing department. There are pretty stringent qualifications, of course, for individuals to meet certain transition and housing criteria, but we do have these, and we receive HUD funding, other federal funding. We've been able to use some of our own cost savings to fund some grants and housing initiatives. But that's just an overview of some of those, and I'm happy to discuss further at another time if we want to go into the specific housing and who meets the criteria for these types of different housing. Child and Family Specialty Plan. That's another change with Medicaid services here in the state. The state a few years ago said, you know what, we're going to put out a request for proposals, and we want children in foster care and children and families involved in the child welfare system to receive services from one plan. As I said, right now there's 4 tailored plans in the state, and currently if you are a foster child, you have your services through VIA, or if you live in the other counties where you have a tailored plan, that is where you receive your service. And so the state said, we just want all these children in the state to have one plan. Blue Cross was awarded the RFP, and so starting December 1st, these children will transition from VIA to Blue Cross and Blue Shield. There's been a lot of work behind the scenes to ensure that this can be as smooth as possible. Our leadership has been meeting with DSS's leadership and with Healthy Blues leadership to ensure that these identified children are given a warm handoff and transfer. So I think those meetings just completed, and we probably have some outliers, some children, and the DSS director here and our leadership are in close contact to ensure that these kids can have a transition and ensure that no one falls through the cracks. We know it's not a perfect system. The good news is we have really good communication and collaboration with social services here. Budget updates. So we know that there hasn't been a budget that has signed yet, and since VIA, we are dependent upon local, state, and federal funds, our funding is dependent upon state and federal. But we also have individuals we have to serve, and our board has gone ahead and approved a budget. And this normally happens every year anyway. When the budget's not approved, our board does go ahead and approve a budget. And so our budget right now for our 32 counties is a little over $1.8 billion. So our total Medicaid funds are around $1.6 billion. And then we have other funds, as you can see here, that we have local, state funds. I did want to make a note that we did receive a $9 million single stream reduction. Now what that means is, because we are a local management entity, we also receive funds from the division to cover services for individuals who do not qualify for Medicaid. And there still are some individuals who are in that position, even with Medicaid transformation, who don't qualify for Medicaid. Those funds are for those individuals who meet a certain criteria for behavioral health services. And then also part of the single stream funding, as we refer to, can cover some out-of-the-box funding that we like to say. So some of that funding that the single stream will cover will be some type of a crisis service or specialized training that we've done for some day programs for members who have intellectual and developmental disabilities. What I can say right now is we don't have plans at this point to cut any services. We were expecting a reduction, and we have been getting a reduction in these funds for a few years now. We were expecting this. And right now, we don't have plans for any type of cuts for individuals who don't have insurance or to cut any current services that we have. Because of the budgets currently that the Assembly has proposed and with DHHS, there is a 3% reduction now because of the Medicaid cuts. There's a 3% and more, it starts at 3% reduction to service lines for agencies who bill Medicaid. So how that worked was we were aware of this, and we were hoping that we waited to implement the reductions. We did along with the standard plans and the other tailored plans in hopes that maybe a budget would be passed, but informing our providers that if a budget isn't passed, we were going to have to be retroactive back to October 1st to recoup the 3% reductions in service lines. So our providers were aware of this. Our providers were in Raleigh, definitely advocating against these cuts, but this is where we are right now with the Medicaid cuts, and our providers again have been aware of this and starting at 3%, and this is again across the state for these service lines for Medicaid. Maintenance of effort. All 100 counties receive maintenance of effort funding, MOE funding. And this is per statute, which has been in existence for quite some time. And you can see here that, again, we have 4 LME and managed care organizations in the state, and the money is funded through the local management entities via in our area. So we rely upon you all in the county to direct us each year to say, this is how we would like to spend the $600,000, which is allotted to Buncombe County based on population. And again, these are services that, money that goes towards services who can't necessarily bill other avenues like Medicaid. And we work with you to ensure that the agencies or service lines that you choose, that you're not duplicating and using county money where there may be a space where this agency could bill Medicaid or have another funding source. So you can see here how much goes to Homeward Bound to help with their housing case management, coordinate assessment, All Souls Counseling, and the RHA Partnership for Substance-Free Youth, work in the community and the schools. And this, again, is based on the fiscal year, this funding. A few highlights with Helene. So when Helene hit the end of September of last year, of course, our providers weren't able to go into work. We had to find members. They weren't able to bill for services for months. And so to help those providers stay afloat, we were able to award them almost $7 million in hardship grants to keep the lights on, to keep the employees going. So when they could turn the lights on again, get the water going, start serving our members. We did immediately, our care managers, start outreaching to providers to ensure that they were going to be able to stay in business. What did they need from us to maintain members? We did launch the Back at Home Helene Housing Program. This was part of Helene funding as well, and we're working on that. That is funding for housing for individuals impacted by Helene. Again, I can give you more information about that later. There's criteria for that. We also participated in the shelter transition team, worked with a lot of county agencies and individuals to get folks linked to services, and of course outreached a majority of our members who were impacted by Helene during that to make sure that they were connected. You know, our pharmacists did pieces like overriding approvals for members who had lost their medication in the storm and were able to go back and approve medication even though they had just been picked it up or been billed for that. Different pieces like that we were able to do for our members. A few other notes I just want to say I didn't put in the presentation. This week right now, VIA is facilitating the CIT training, the crisis intervention training out at Canoe Lane in Woodfin at the law enforcement training facility. And I just checked in with our trainer, and it looks like we have 10 attendees there, and we have some Biltmore Forest Police, we have law enforcement who works at the airport, APD, a few folks from Sheriff's Office, and Asheville Fire, and someone from Fletcher who are there, and it's a 40-hour-a-week training. We have piloted a few new programs as well, just here in Buncombe County, in our catchment, to serve individuals in the community who meet a certain threshold or criteria who need mental health supports, and we call them ACT teams, Assertive Community Treatment Teams. It's a Medicaid billable service, but we were able to receive funding from DHHS to pilot some different programs to serve individuals in need. One of them is through RHA, one of our providers, and it's called the Forensic ACT Team. And this is to work with individuals who have involvement with the criminal justice system to help them work through the system and get linked to services. Another is called our Dual Diagnosis Capable ACT, and that's to work with individuals who have a substance use primary diagnosis, because on these teams, normally when you qualify for a team, you have to have a mental health primary diagnosis. So these teams help with substance use primary. This is with an agency called Pyramid or October Road, working with them on that. And we also have another program that we implemented about a year ago called the Virtual iPad Program, Virtual Crisis iPad. We're working, I think they have one or two in the Family Justice Center and then in the Detention Center that and basically, the premise of that is we had talked with Josh Pierce and some other people that said, you know, we have a crises here in the detention. When people are coming, I'm sorry, not to the detention, the courthouse. You know, when people come to the courthouse, it's probably not on their best of days. You have folks that are walking in there in crisis, and sometimes they need mobile crisis. Well, it takes a while at times for mobile crisis to come if they're on another part of the county. They can't find a parking space. So this initiates the process. There are a few deputies that are aware of this, and some of the justice staff there at the courthouse, and they're able to get the individual in a private room, call mobile crisis, get them linked on this iPad, and then let mobile crisis and a responder come on the way while they're talking with someone, and the same at the Justice Center as well. I think that's the broad strokes there. Do we have any questions?
Thank you, Angela. Are there questions?
Well, I just want to say thank you for all that very useful information. And if you could send us some more information on the housing support grants, if you could just send that to staff for us, just so we'd know more about that, I'd appreciate it.
Absolutely.
And I also just want to thank you so much for the Hope for NC, the helpline for our people. And I still feel that there's a very strong need for that. So the more we can do to just kind of, I know there was a lot of information in the beginning, communication around it, but I think it'd be helpful to kind of elevate that and get that communication back out again.
We were grateful that funding was extended.
Yes, thank you.
I'll echo that thanks, and just appreciate that you've been an active participant in many of our boards and commissions. I'm kind of losing track of how many you've attended any given week. But it's been really helpful to have someone with your perspective and your lens kind of informing what's happening at the state level in behavioral health, and using that to inform what we can do to be proactive about mental health and substance use in our community. I don't think we have all the solutions by ourselves, but tracking what you're doing has been helpful.
Thank you.
It's great to put a name with a face. It's great to meet you. I am the Forensic Act team for RHA. I heard about that in the community. I think that's going to be phenomenal. Also, I have heard through the community actually this week about some homes that are closing, 5,600 that's the code for adult, the type of home they are. I'm not sure. I'm concerned about that. And then I've also been in contact with providers within the area. One is in the process of closing a family care home that's in the heart of Asheville. And then Riverlink is closing several homes, and I am concerned about what that's going to do with the services that we need for our residents here with mental health, especially with the homeless situation that we're in currently.
So Commissioner Horn, I'll look into that. I don't obviously know offhand, but I can have someone in our provider network. We can get with you all on that.
I would, yeah, that would be
Okay.
great. Thank you so much, Ms. Garner.
And Angela, thank you and RHA for your partnership with the Buncombe County Sheriff's Office on the co-responder program as well. We continue to hear really good feedback in the community and Sergeant Freeborn in particular about that. So thank you. Are there further questions? All right. Thank you, Angela. It's nice to see you this evening. All right. Our first item of new business is the adoption of our Helene Recovery Plan, and Kevin Matson, our Helene Recovery Officer, is on his way up to give us some more information.
Good evening, Commissioners.
Good evening, Kevin.
Kevin Madsen. I'm the County Helene Recovery Officer, and I'll be speaking to you today about the Helene Recovery Plan. Make sure I'm set up here. Okay, so one of the keynotes for today's plan discussion is that there is a request for board action to approve a resolution adopting the plan at the end of today's presentation, which includes the elements for the 114 projects that are across the county, including our 6 municipalities and the county's 31 projects. With that, adopting the county's 31 projects and a commitment to maximize the resources and implementation for accomplishing those goals and continued collaboration for regional partners. As stated, our municipalities have components of this larger Tropical Storm Helene Recovery Plan, which our partners in Weaverville adopted last night, and our partners in the town of Asheville, city of Asheville, are working on this evening. It is grounded in public input from engagement from our Envision Buncombe surveys, also multiple town hall conversations engaging with our public community members, and extensive collaboration efforts that are built on consensus when they built these projects. The plan was built through multiple phases, including a section on public comment once the plan was in draft format, which occurred in September, October of this year. And we are looking at finalizing that plan with tonight's adoption. The Buncombe County portion of the plan is linked to our 2030 strategic plan focus areas. Of those focus areas, growth and development is aligned with 7 projects, economic development with 3. We also have public safety with 13, energy and environment with 3 as well. And one of the keynotes is education's incorporated into multiple components of the document itself. And it's really that framework incorporating most of those strategic focus areas. Of course, we did align the projects with the Envision Buncombe priority list. So our projects here are outlined with the project quantity and, of course, the percentage of those targeted areas with infrastructure investments, our disaster preparedness and resiliency, wildfire prevention, rebuilding parks, so on and so forth. All of these were elements incorporated into the planning document as we built that and built consensus on those projects. Now, before taking a few moments to highlight the 31 project areas, what I'd like to do is highlight that each of the projects identified today, and we'll go through all of the different project components, that they are all assigned to a lead county department, and that county department has partner agencies supporting all of their efforts. And those partners can include internal partners, but also our local, state, regional, and federal partners as well as they accomplish those goals. Each of the project areas are also built with indicators. So they have a indicator on timing, so short, medium, long term. Also complexity, so high complexity, moderate complexity, extensive complexity, as that's defined. And of course, costing. And all those are based on estimates. As we built the Helene Recovery Plan, those estimated costs were built on what we think those projects and the associated sub-projects would be. So starting out, we'll highlight that affordable housing development is a key element, our food security, our code of ordinance amendments, and commercial district revitalization. And when we talk about food security, we're talking about developing and implementing a county-wide initiative aimed at providing food security through strategic planning, local food system development, reinforcing those community partnerships, and emergency preparedness. I think it was something we leveraged more recently with our recent activities with our incident management team, led by our partners at Health and Human Services. So already working through a lot of those efforts, so building on those as we look at the recovery plan. Of course, we also have our community memory project focused on the Come Hell or High Water, our community organization support, community risk reduction campaign, and of course, our critical facilities upgrades. All of those have different aspects built to them, but highlighting our community organization support, that is really enhancing our disaster preparedness, response, and recovery capacity by partnering with our community-based organizations, such as our nonprofits, our faith-based groups, local initiatives that collaborate to address the needs of the communities affected by this disaster. Our team has been attending the Buncombe County Long-Term Recovery Group and collaborating with their efforts as we're building our efforts as well. Also, cultural asset restoration, and when we talk about that, that includes our park systems. I know that Joseph will be talking about Hominy here following me. Also spoke at Owen Park for the last meeting. So all of those fall within that cultural asset restoration, restoring our county parks, libraries, community centers to address storm damages while enhancing and expanding our cultural and recreational amenities for our communities. Of course, disaster response heavy equipment, getting those resources locally, are partnering with our organizations, down payment assistance, and of course, looking at an emergency operations center for our county efforts. We also have aspects of the plan on our emergency shelter facilities, our fleet and facilities restoration, home repair, and landslide mitigation. Landslide mitigation, of course, includes our communities that were affected by our large landslides. We actually have been working on our Grovemont RFQs to support that effort, really by conducting assessments of landslides on county-owned property and private property, identifying those imminent threats to life, property, and infrastructure. So we're seeking mitigation efforts and opportunities through state and federal partnerships to identify different resources to support the communities impacted. Of course, we also have our mental health training and support, natural hazard monitoring systems, open space property, and the preparedness action plan. And of course, when we talk hazard monitoring, we're looking at stream gauges, also our alerting systems to notify the community in the event of a hazardous situation. The preparedness action plan is looking at implementing our recommendations from the Tropical Storm Helene preparedness action plan, enhancing organizational capability, and we're building that in partnership with the recovery plan. So the preparedness action plan is a component of the recovery plan, and it's also a standalone plan that's working collaboratively to building that capacity. And then, of course, we continue on, public art, our public safety communications resilience hubs. And those resilience hubs are really looking at adding features to our public facilities, which could be libraries, community centers, our schools, for resilience before, during, and after an emergency, looking at an area of the community where we can enhance energy resources, telecommunication, possibly wind hardening, and then, of course, flood proofing, to mitigate risk for those community centers and providing opportunity for resources at those sites as well. And then, of course, sewer extensions and septic mitigation. The skills training and employment program, STEP, small business grants, social services emergency response plan, and stream stabilization. And we are working on EWP funds for stream stabilization as we speak through the plan implementation and development process. And then, of course, our last slide wrapping up those 31 projects is our Swannanoa Small Area and Resilience Plan, Vehicle Resilience, and Wildfire Protection Plans. And of course, with the Swannanoa Small Area and Resilience Plan, that effort is underway with our planning department, and they're engaging the Swannanoa community in needs priority assessment and the development of a framework to guide future development and public investment in the unincorporated area of Buncombe County, clearly impacted by Helene. And then the same thing with our wildfire protection plans. They're working with the communities in Barnersville and Swannanoa as well, an effort that was actually started prior to Helene. So when we talk about early implementation steps, the 31 projects are really the framework that's outlining our next steps, and the sub-projects within those 31 projects and the implementation strategy to build those projects is really what we're looking at for the next steps. Right now, we have roughly 136 sub-projects, but that number is expected to be to fluctuate as we develop that implementation strategy. And then, of course, associated with that, we're building scope with timelines. We're narrowing down the contracting for external sources, and then we're also looking at what funding would be needed for those as well. Those sub-projects are being captured in resources, project management tools, to allow us the ability to build out a framework for the implementation strategy. And then, of course, we're identifying funding streams through our state and federal partners, our FEMA public assistance, and of course, any grants that are made available to our community. And as soon as we look at them, we try to identify which project they align with the best. And then the Helene Recovery Office, we have just closed 3 positions for that office, 2 project managers and 1 business analyst. And we're looking to fill those positions by the end of the year to support the project management and overall collaboration on financial and grants reporting. And then, of course, we're continuing to partner with our county departments and our external partners through the entire process, ensuring that we've got strong buy-in, and we're really maintaining that whole community approach to ensure that we're being thoughtful into the development and implementation of these projects. And just here's a list of a few examples that we have on our projects. And I did mention a few of these already with stream stabilization and, of course, the community wildfire protection plans. And then our fleet and facilities restoration. We're working on repairing and replacing the communications roads to our towers. So that was a quick summary of our Helene Recovery Plan. What we're looking for tonight is to progress that effort after extensive work over the past several months or several years to request for board action. And what we're looking to ask is for approve a resolution adopting the Buncombe County Tropical Storm Helene Recovery Plan, which includes the following authorizations. Endorse the plan in its entirety as coordinated multi-jurisdictional program for recovery and resilience. Adopts the Buncombe County section of the plan, including the 31 project areas, commits to maximizing funding and resources for the successful implementation of recovery projects, and commits to continued collaboration with regional partners to ensure coordinated implementation of the recovery plan. And then any questions from the board?
Thank you, Kevin. Commissioners, do you have questions?
I don't have a question, but I do want to say thank you. All of these projects are very important for our community, and so I appreciate all the time and effort that staff has put into this, as well as working with all of our partners across Buncombe County, all the municipalities. And I think this is a really good set of projects to move our community forward and help us recover. And of course, y'all know that the food security is just so near and dear to my heart, and I think we've seen that again most recently, right? We went through COVID, Helene, and then what we just went through. So I'm very thankful that that is also a priority to work on that, to ensure that our community members are never hungry.
I agree, Commissioner Wells.
I just want to commend staff and everybody who worked on this. This is really a really big, impressive document, and the partnership with our local governments in the county is really critical to getting this all done, and just the collaborative spirit that went to getting this moving. And I think even it's great to have you on board. We're so thankful that you're on staff now. You are part of the progress and getting towards this goal. So thanks for helping drive this now that you're on board. Can you speak a little bit about progress updates? I mean, this is a lot of work that's going to have to happen. So how are we going to track this? How are we going to make sure that we're actually achieving these really important goals?
Thank you, Commissioner. And as you noted, I am new to the team as well, so also would like to recognize the countless hours and the honor that I have to present this, not even being involved in the development of it. It really is an impressive document. With regards to next steps, one of the key things we're doing is we're building out the implementation strategy now. So we're taking, once adopted this evening, we can then progress to the next phase, which is actually building out how we're going to get these projects on a timeline and grant sources with them as well. So that is going to be our big push in December. And then, of course, hiring staff. The hiring of project management staff will allow the opportunity to give more responsibility to the Healing and Recovery Office, free up additional county time in other departments, but we'll be supporting each other through that progression. So yeah, we will, all that being said, one of the key things we're highlighting now is identifying grant sources and trying to get submissions in for possible funding streams for these projects.
Fantastic. Thank you so much.
Thank you.
I think we've often heard Taylor Jones say that recovery starts the day after the storm. And here we are now 14 months later, which feels like a short time to accomplish such a significant recovery plan that we're here to approve this evening. I think most everyone has said it, how grateful we are to the work of all of our staff to getting us to this point tonight. But I think we would be remiss if we didn't acknowledge the work that they put into collecting feedback and input from members of our own community so that as many voices collectively were heard across Buncombe County after such mass devastation that we experienced last September. I think it's also really important to note how our residents and our local governments, the municipalities that were involved in this alongside Buncombe County government, how everyone came together when it mattered most to put this plan together. And I'm excited about our long-term focus on resiliency as well as preparedness, but also what this means for the future of Buncombe County as we prepare not for if, but when we have the next disaster. So thanks to all of our staff, but to every resident across the municipalities in Buncombe County who ensured that their voice was heard. We have a motion to approve.
Motion to approve.
Thank you, Commissioner Horton. Do we have a second?
Second.
Thank you, Vice Chair Moore. All in favor, say aye.
Aye.
Any opposed? All right, motion carries. Congratulations. Thank you, Kevin. We look forward to working with you and your soon-to-be team. Thanks, Commissioners. Our next item of business is a resolution to approve the contract with the John R. McAdams Company. And Joseph Guzman with Parks and Rec Project Management is here to give us some more information. Good evening, Joseph.
Good evening. Thank you for having me to talk about this exciting project. I am here. I'm Joseph Guzman, Parks and Rec Project Manager, as you touched on. I'm here to talk about the Hominy River Park Recovery Project. So Hominy River, just like many of our river parks and just like Owen Park, had catastrophic damages during Tropical Storm Helene. The French Broad River actually met Hominy Creek right here on the peninsula of this park, completely destroying it. It is a priority of the county to rebuild this park. It has been since the day after the storm. And we are going about this in a two-phased approach, similar to how we're doing Owen Park. So just to briefly touch on that again, this first phase, which this contract is for, will be heavy on the engineering. It'll be heavy on looking at the stream bank restoration, and it'll be heavy on looking at how we can build the park back better for future flooding events. We also want to reach out and see how the community can best use this park, but also it is very important to note the conservation easement, which is on this plot of land, which is with Riverlink. So early on within this phase one of the project, we plan to meet with Riverlink, with our engineer, and make sure everything we plan to do is within the guidelines of that conservation easement. So then that goes into phase two. This is when you get your 100% construction drawings. This is when we can take the schematic designs to the engineer and say, this is what we want to build back. Very similar to Owen once again. At the end of this process, we will then have 100% construction drawings, which we can then take out to bid, obtain the permits needed for construction, and then start construction after we receive those bids. We also will be having this engineer do construction administration throughout the project, and also working with Riverlink in this phase as well to make sure everything is within that conservation easement. So the contract itself, we put out an RFQ. We got 9 submittals. After the committee reviewed the submittals, we selected McAdams, which is a Raleigh-based engineering firm. They are actually working with the town of Waynesville right now, down the road, on a very similar project to this. Talked to him the other day about how he's able to help us tap into some of these FEMA funds. We're going to look at FEMA PA possibly, and also EWP for this project. Being that Hominy Creek, it will mainly be looking at stream bank restoration and the French Broad restoration. It will be a lot of EWP, hopefully we can tap into a FEMA. So tonight I'm here to request the approval of McAdams. The contract is $159,432.50. Love the 50 cents, but yes. After the contract is approved, we plan to do a project kickoff with McAdams and then help do a draft project timeline. And then at that point, we can share with the community what a detailed timeline might look like for reopening this park. So on that, I'll open up for any questions.
Thank you, Joseph. Commissioners, questions?
I have to know, why the 50 cents?
I'm looking forward in this project kickoff meeting to ask why the 50 cents.
Very
But it's
specific.
detailed. We did do a lot of contract negotiation with McAdams. The first number came in a little higher than we wanted, and we looked at some things. We saw a lot of the community engagement. We can work with CAPE. We can work with our county resources we have, and we're able to bring it down to that number. So.
Well, this is definitely a beloved community park, so I know people would be very excited to be able to get back out there when the time is appropriate and enjoy this space.
And I just wanted to ask, I'm sure it's built into everything we do, so I don't ask it for a particular reason, but there'll be some sort of community engagement element that would allow folks to provide input on changes to the park that maybe weren't there before.
Yes,
Okay.
yes, and we also plan to use our master plan that we've been working on
Okay.
to help guide us within this rebuild as well.
That's great. Well, Madam Chair, I'll offer the motion to approve, but sorry, go ahead.
Just a quick question. Can you speak to some of the funding sources, grants, reimbursements that are helping fund this significant investment?
So we met with our Tetra Tech group, who's our consultant, last week on Friday, actually, to help navigate this. And we are looking at how much we can cover through EWP. We feel confident a good portion of it will be covered through that EWP with FEMA, being that this park is mainly stream bank and riverbank. But we do know that there will be some other things we have to tap into for what components we want to look at within the park. If we do a community outreach and we find that we need more parking, or a better traffic study is something we want to look at. Those might be pieces where the county might have to help, or we might have to look at other opportunities.
And just to keep us on the level, Robert's rules wise, I second the motion.
Thank you. All in favor, say aye.
Aye.
Any opposed? All right, motion carries. Thank you.
Thank you.
Nice to see you, Joseph. All right, we have a budget amendment for our open space bond allocations. And Kevin, please tell us how to pronounce your name when you join us. I'm not going to try to butcher it this evening, but Kevin is our passive recreation land subcommittee chair.
It is Kevin Conracode.
Conracode, thank you very much.
So I'm here today to present the consensus of the passive recreation subcommittees of the projects that were proposed for funding. Let me see. So the open space bonds were passed by ballot initiative to fund greenways, open recreation land, and farm conservation. As of today, 17.5 million has been allocated of a total 30 million. And today we're here to recommend $4.3 million for funding, leaving 5.5 million for future projects. The Passive Recreation Lands Subcommittee is comprised of people from the Parks and Recs Advisory Board and the Land Conservation Advisory Board. The members are Anna Babcock, David Burnett, Kevin Conracode, myself, Lena Richards, and Bob Gale, Bob Turner, and Matt Fusco. The review process, we opened up application window and community advocates submitted projects that were eligible for the funds, where staff reviewed it for eligibility. It then went to the Passive Recreation Land Subcommittee, where we reviewed all the merits, and here we are tonight to present them to the board for final consideration. 11 projects came across our radar, 3 from local government partners, 8 from private entities. The total request was just shy of $11 million, the smallest request being $102,000, with the largest being $3.3 million. This is a list of everything that will go to proposal or not to be proposed today. And we'll get into more detail on these shortly. And this is a great map. I'd like everyone to take a look at this just to show the yellow area is protected land or recreation land area. The green are projects that we plan on moving forward with, and the gray are ones that we will not. But it reaches broadly across Buncombe County to areas that are underserved in recreation parks. The first that we are not recommending today, we're not recommending because of good news. This is the Deaver View Mountains, roughly 350 acres, and some bond funds have already been earmarked for development of this land in order to apply for the Outdoor Recreation Legacy Partnership from the state. And we did win that, that grant. And so this project, the funding is there to move forward with it. And so it will not need any further funding from the bonds. The next is Ridgecrest Connector in the town of Black Mountain. This one, due to constraints of recovering from Helene, we do not feel Black Mountain is currently prepared to move forward with it, so we will not recommend it this evening. The next is the town of Weaverville's watershed. They wanted to build trails, but they are focusing on storm cleanup of this property, so they will not be moving forward at the time. The next is Woodman Trails Trailhead in Swannanoa. Again, due to Helene, there'll be further review of this project for alignment for future greenway development. And that brings us to our list of recommended projects. The first is roughly 33 acres on Sand Hill Road that aligns with greenway plans for the broader countywide system. And we are recommending funding up to $750,000, which is less than the property owner had required for purchase. We believed it was too much at the time, still do. So this is the recommendation going forward. The next is Haw Creek Park Greenway. This is a key connection in the Haw Creek neighborhood that connects further deeper into the neighborhood to a City of Asheville park. Gateway River Link. This is just north of the Pearson Bridge. It is on a currently path for a greenway, and it will provide additional recreation space in the Weaverville or along the greenway. Excuse me. Further, Hominy Creek Greenway improvement. This is a corridor that was impacted by the storm and is routinely used by the neighborhood. And so it will be funding to restore some of the trail to a more natural surface. And Warren Wilson College, we are currently conserving some of their land with the Bond Recreation Fund, but they requested another 150 through this process to further repair trails from Hurricane Helene. The town of Woodfin wants to increase the size of the Riverside Park near the Blue Wave. This is our largest funding request, and it will create a recreation haven up by the Blue Wave in the town of Woodfin. Further is Camp Greer. They have a piece of property in southeast Buncombe County, and they want to build trails on a 225-acre conservation project. There's the map. In total, our funding recommendation of these 7 projects would be a total of $4,376,262. It would introduce 254 acres to public use, 33 of those acres are newly conserved, and there will be 14 miles of multi-use path. And the remainder after this allocation, if approved, would be $5,558,168. So this evening, I'd like to have a request for board action to make a budget amendment to adopt the funding recommendations as proposed. And I can open up the board for questions. Oh. Can you bring that back up? There was, I need that back.
Can you bring it back up, please?
Considerations going forward. The Passive Recreation Land Subcommittee voted to recommend commissioners hold the remaining funds for future committee and subcommittee funding cycles. Potential future investments include funding for projects that need additional planning and design, funding for other community-led projects, or funding for county-led projects such as those coming out of the Parks and Recreation Master Plan or the Hazard Mitigation Funds. And Rachel Sawyer here is to follow up on one property.
So thank you to Kevin Conricode, Chair of the Passive Recreation Land Subcommittee. And I noticed Ann Babcock, another member of that subcommittee, is in the room, as well as several of the folks that coordinated with staff and with subcommittee throughout the application and review process. Wanted to come up and offer some staff information. When I presented at your briefing 2 weeks ago, there was one item that I wanted to follow up with, which is just a quick piece of information on the Warren Wilson College project. I said I would look into whether or not the trails that they're improving are on the parcel that is being conserved through the most recent conservation easement, and we have confirmed that yes, that public access that they will be granting through this award, if approved, is on the parcel that has the conservation easement, but the funds cover different uses. In addition, staff wanted to come up and provide some information about one of the projects. If you, I guess I can flip back to Balsam Gardens, which is the 33 plus or minus acres on Sand Hill Road. Staff has done some additional research and discussion and vetting and is not recommending that commissioners move forward with this project at this time. So I can talk you through a little bit of that rationale and then what your options are this evening and going forward. So as a reminder, this is a piece of land owned by a private owner. It's currently in agricultural use. The proposal scored really well for its alignment with Inca Heritage Trail, which is a greenway in progress. And the subcommittee, as Kevin mentioned, did back down on the amount. The requested amount was $1.63 million, which would have roughly equated to almost $50,000, $49,500 per acre. Feeling that that would be overpriced, we gathered some additional information from the tax office and Ag and Land, and others spoke with county legal, but particularly from the tax office, looking at 2026 estimated totals, they would run in the ballpark of $15,000 to $19,000 per acre, depending on the size, the shape, the amount of floodplain on the property. And this property does have roughly 85% of the parcel encumbered by the floodway. So the staff is not recommending the project largely because the Inca Heritage Trail is currently at risk. That project is not in a strong status at this time, with still some negotiating of pieces further, I guess, at a different section of the trail. Additionally, this parcel would not have been a critical link in the Inca Heritage Trail. It would have been additive, if you will, an extension to the Inca Heritage Trail. So in addition to those items that I specifically mentioned already for considerations, another thing that we've talked a lot about as staff is our participation in the Hazard Mitigation Grant Program, where Buncombe County will be acquiring, essentially, as a result of this, hundreds of acres, probably, of land in the floodway that will need, at no cost, because that's a federally funded program, and those parcels will need programming, they will need evaluation and assessment, potential management, and/or programming. And with those uncertainties, the timing does not feel right for additional proactive seeking out of land to acquire. For those reasons, we have not recommended it, fully in respect of and awareness of where the subcommittee landed. And we've talked with subcommittee members about it, and they're familiar with where staff has come down. So we've prepared you 2 budget amendments. Kevin made a recommendation on behalf of the subcommittee, and that would essentially be your budget ordinance A. Approve 7 projects. I don't know which slide I should be pointing at. Yes, let's go back. Thank you. Which would be all those ones in green, 7 projects, for a total value of $4,376,262. There is another budget amendment prepared for the board should you wish to not recommend that specific project, and that's labeled in your packet as Budget Ordinance B. So that would be 6 projects, and the total there would be $3,626,262. Either way, it does leave remaining bond funds, as Kevin described. The budget amendment, or budget ordinance A, would leave roughly $5.5 million for future allocations. Budget ordinance B would leave roughly 750,000 more available for future programming. So with that, we are now either available to answer any questions that you may have.
Thank you, Kevin and Rachel. Commissioners, are there questions? Yes. Go ahead, Commissioner Ball, and then Commissioner Swan.
Thank you. So, thank you all for this. I'm curious if this Balsam Gardens project could be potentially submitted for other grant funding. I mean, it's in the watershed, it creates resiliency. Are there other pathways for that?
It potentially could. There has been some grant funding to do some stream bank restoration on the property already. It may, along Hominy Creek, may be eligible for site improvements. And then if and when the county finds itself with an active Inca Heritage Trail project, we could pursue conservation easement. That's another method that we've looked at to gain access to and through the parcel for future use. Not a conversation that we've had with the property owner. And then we absolutely can explore grants. I've not found one yet because there's not infrastructure on that site. It's undeveloped. Its current use is agriculture.
What about the DEQ blueprint grant? Is that potential?
It is on our radar screen. Thank you for bringing that
Yeah.
up, and we're researching it.
Okay.
I don't know that that's a fit for this particular parcel, but if it is, we'll explore it.
Cool. Let's continue to explore that. Thank you.
And I just wanted to ask to clarify for me, staff's recommendation on the Balsam Gardens. Is it just the status of the Inca Heritage Trail, or is there another? If you could repeat for me, just
Sure,
the other reason why you're.
The status of the Inca Heritage Trail is the first consideration on the list. Additionally, we looked at it would not have been a critical link to the Inca Heritage Trail. It extends, it's additive, or
Okay, this project itself is not a critical extension of the Inca Heritage
it
Trail. Is that
wasn't
what
part
you're
of the Inca Heritage Trail original design.
Right.
But if it were to come into play, it would extend the Inca Heritage Trail.
I see. Okay.
So the Inca Heritage Trail could happen without this parcel.
Right.
So that was an additional consideration. Third consideration was the encumbrance by floodway. Because of its extremely irregular shape and how much floodway there is on this property, it is not likely, well, those characteristics significantly inhibit development potential. So it doesn't feel like there would be an imminent loss of ability to access that in the future by, say, a housing development going in its place. It's going to be tricky to develop because of those constraints. So it potentially could be there if and when the Inca Heritage Trail comes to pass in the future, whether through acquisition or through conservation easement.
I see what you're saying. It's not at risk of being developed and therefore lost to conservation potential.
That's a good way to
Yeah,
summarize it.
I see. Okay, okay.
And then the other two listings were the price. We're not on the same page in terms of price at this time. We've not entered into a negotiation. And the owner is aware of the $750,000 recommendation. And then finally, the unknown amount of floodplain floodplain mitigation work coming down the pipeline toward us through HMGP. Those reasons taken together helped us land where we landed.
Thank you.
Go ahead, Commissioner Wells.
So first of all, Kevin, I want to say thank you to you and the committee because I know you all had done a lot of work on reviewing these and everything prior to Helene, and then we had that very long time, understandably, where we weren't able to move forward. And thanks to all of you for picking this back up, and thanks for Rachel for coming on board and working with you all to pick all this up and to assess like which projects now we're able to move forward and everything. So I just wanted to acknowledge all the time that y'all have put into this, and also the reality that it's a completely new program that y'all were figuring out from scratch, because it's not, we didn't already have this, like we had our conservation easements and we had our Buncombe County rec and all of that. So thank you all very much. And Rachel, I appreciate you following back up on the Balsam Gardens, because we did have questions around this. And, I mean, I would love it if this project was like ready to go and ready to move forward, but I think there's just too many questions around the Balsam Gardens that you already specifically elaborated on. And my hope is at some point, maybe that can be utilized and tied in with the Inca Heritage Trail. And I still feel we need more information and we need an update on the Inca Heritage Trail and the status and what's going on with that. So I appreciate you sharing that information. And then I was just going to speak, I know we'll just be voting on the budget ordinances, but you also had on that last slide a recommendation about the rest of the funds. And what I would just say to that, I think, what that recommendation is good about what you're wanting to hold those funds for. But rather than us voting on that, I would like to request that staff review the projects, like look at the totality of where we are with those bond funds, and then see are there potentially projects where we always know sometimes the costs go up or this or that. So I don't want to tie us to something and say we're going to vote to put all those funds aside right now. But if y'all could look at that and then maybe come back with a recommendation, after the first of the year about this is the amount of funds that we could say that passive rec could go and start another cycle with, then that's what my recommendation would be around that. And that way we can have a very informed decision and then hopefully be able to let y'all know, a specific amount that you could start working with again for future projects. And with that, I'm willing to go ahead and make the motion that we approve the budget amendment with the budget ordinance E.
Second. Thank you, Commissioner Whitesides. All in favor, say aye.
Aye.
Any opposed? All right, Budget B passes. Thank you both. We appreciate it. All right, we have several board appointments this evening to make. Our first is the African American Heritage Commission, and we have one applicant, Christopher Gordon.
Move. Nope.
All right, we have a motion and do we have a second? Thank you, Vice Chair Moore. All in favor, say aye.
Aye.
Any opposed? All right, Christopher Gordon will serve on the African American Heritage Commission. We have our Parks, Greenways, and Recreation Advisory Board. We have 2 appointments and 2 recommendations, Emily Troisy and Jeff Fody.
Move to appoint Emily and Jeff.
Second.
Thank you. Second by Commissioner Ball. All in favor, say aye.
Aye.
Any opposed? Great. All right. Thank you, Commissioners. Do we have any updates from board members on boards that you serve on?
Sure, just the continued progress. So at the early childhood, we called a special meeting to discuss how we're going to make the highest and best use of the funds that we've dedicated as a county with a focused investment strategy. And I think we had a really robust discussion about where we can have the most impact in solving an issue that is of great importance to a lot of people and parents in our community about what affordability looks like in a time that no one's really feeling great about our economy. So making life a little bit easier and just having a targeted plan seems good, and we have a little bit more direction than we've had in previous years. So looking forward to seeing that work continue.
Thank you. Any other? All right, I will give a quick update. I attended the School Justice Partnership meeting on Friday afternoon. It was a really interesting presentation. We learned that we have a 43% decrease in complaints on juveniles across Buncombe County, which is terrific. The not so great news is that a disproportionate number of those continue to remain among Black juveniles. The next steps within this partnership is to continue gathering additional data. Hannah Ledgerton is leading that effort. She answered a lot of great questions, took a lot of feedback that she'll be bringing back to that committee, I think, within the next quarter. And then work groups will be created amongst the members of that partnership to begin addressing those disparities, what can be done within our community. That consists of members of our judicial system as well as members of our Asheville City and Buncombe County schools, leadership teams, and principals at different institutions within those schools. It was my first time attending, and it was a really, really interesting meeting, and I look forward to coming back in a couple of months. Anything else? All right, Commissioners, our next briefing will be held on December 2nd at 3 p.m. in our first floor conference room, and our next regular meeting will begin at 5 p.m. right back up here on December 2nd. Kurt, do we have a need for a closed session this evening? All right, thank you. All right, Commissioners, do we have a motion to adjourn?
So moved.
Second.
Thank you, Commissioner Whitesides and Vice Chair Moore. All in favor say aye. All right, we are adjourned this evening. Thanks, everyone, and have a happy Thanksgiving.